In this video, we are going to see a quick review of drug salbutamol. So let's get started. First, we'll see what is salbutamol. Salbutamol is a beta 2 receptor agonist. Its mechanism of action includes a decrease in calcium-mediated contraction in bronchioles. It increases cyclic AMP, which activates protein kinase A. This activation of protein kinase A inhibits myosin light chain kinase, which is the mediator of contraction. The main clinical use of salbutamol is bronchodilation required in asthma. So that's the main use. The pharmacokinetics include its use as inhalation, which is absorbed systemically. It can also be given via IV route. When salbutamol is given by inhalation route, it is partially metabolized and is excreted unchanged in urine. The main adverse effects of salbutamol is feeling shaky, headache, and muscle cramps. So that's it. Thanks for watching. If you like the video, don't forget to like, share, and subscribe PharmCept. Thank you.